I'm Dr. Hockley from Dermatology. This is my partner, Dr. Starr.
Hi, everybody.
And today we're going to talk about malignant melanoma, what to look out for, and why to be concerned about it. Dr. Starr?
All right. So this song is Bob Marley, and he died at age 36 back in 1981 from melanoma. So that's why we chose this topic for today. The first issue we're going to discuss is what is melanoma and why is it bad? Melanoma is essentially a cancer that is made up of these cells called melanocytes. Melanocytes, as some of you may know, are the cells that give your skin pigment. When they start to divide in a dangerous fashion, they have the potential to sort of spread around the body and do things like go to your brain and end your life. That's why it's a terrible thing.
So the clinical presentation of a malignant melanoma, it usually, almost always, begins with a spot. It could be anywhere in the body. In fact, Bob Marley died of malignant melanoma, and his spot was on his toe of one of his feet. So the spot doesn't go away, and it continues to expand over time. And that's the clue that something's wrong. The color is usually very dark. About 90% of the time, it's going to be shades of black to a very deep brown or a black brown. But about 10% of the time, it could be any color. In fact, there is this one kind of melanoma that's called an amelanotic melanoma, which is sometimes very difficult to detect.
Yeah.
So, Dr. Starr?
We have a method that we teach patients to sort of put into place to identify dangerous moles, and we call that the ABCDEs of melanoma. This is a mnemonic device that we actually want you to memorize. We want you to memorize this and you apply this to moles when you check your skin once a month. The first of the ABCDEs is A. It stands for asymmetry. So if you have a mole on your body that you can't draw a line down and have it reflected about that line in a mirror image, that's a concerning mole, and you should get it checked. Especially if you're over 35, getting new moles, that's when it becomes concerning.
B stands for the border. You like to have a well-defined border. Some clues that something's wrong is if you have a sort of a fuzzy border that kind of blends in with the rest of your skin. You don't see that clear-cut demarcation between the mole and your skin. The other thing that's already been mentioned is the asymmetry that can sometimes develop when you have a malignant melanoma. The C, Dr. Starr?
C stands for color that's uneven. If you've got a mole on your body that has more than one color, if it's not all the evenly pigmented tan all the way throughout, that's a concerning mole, right? If part of it's black, part of it's brown, part of it's pink. Do not ignore that. Bring that to the attention of your doctor when you see him next.
The D stands for the diameter. We sort of use a size of about the size of a pencil eraser as a guideline for you to be aware of moles that are about that size. If they're larger than that, then you really should get it checked out. If you were born with it and it's not changing, things are probably okay. But nonetheless, that 0.6 centimeters or 6 millimeters or the size of a pencil eraser is about the time when you want to start paying attention to your moles. And finally, probably the most important one is the E, Dr. Starr.
Yeah, and E stands for evolution. If a mole is changing, that should be checked, right? So kind of the cutoff for concerning lesions is age 35. If you're getting new moles after that point, especially if they're evolving or changing, bring that to the attention of your physician. Okay, next topic is what will happen if your doctor finds a melanoma? If your dermatologist identifies one of these things on your body, what happens next? And the answer is we're going to try to remove it, right? The earlier you catch this thing, the better off you are. If it's something called melanoma in situ, it's been caught very shallow before it's had a chance to invade into deeper structures of the skin, then you can just remove it. You can cut it out and sew the patient up. If it's a deeper melanoma, if it's become invasive, then there's a good chance you'll be having your lymph nodes examined. We might have to send you to surgical oncology where they could do what's called a sentinel lymph node biopsy. If it's spread beyond that, then you're looking at possibly chemotherapy and other interventions. What else?
And finally, just to mention that if it does become metastatic where it's spread to other organs, all is not lost. There's some very good treatments today for even metastatic melanoma. There's medications that are called checkpoint inhibitors that are able to control a melanoma's growth and actually sometimes keep it under such control that it can disappear from spread to other organs. Ex-President Jimmy Carter is surviving today because of that type of treatment for his melanoma.
All right.
Sunscreens, zinc oxide and titanium dioxide are they block or screen a large portion of the spectrum of the sunlight, so they're highly recommended.
Yeah, so that's the last topic. How to prevent it. Wear sunscreen and stay out of the sun. Don't go to the tanning bed. If you go to the beach,
No
wear a rash
tanning
guard.
beds.
Yeah, don't do the tanning bed. That's pretty much it. Thank you guys for watching. Hope it's been informative.
Bye-bye.